I'm Scott and I've been living with MOGAD for over 5 years. So far I have just had the one initial episode of MOGAD, and after a long steroid taper and 18 months of taking a preventive treatment, I am no longer on any medication related to this condition. In my case, I thought that quick treatment and diagnosis of the condition was great. My doctor at Leeds Teaching Hospitals actually predicted that it was MOGAD before any antibody test results had come back, and I believe this had a massive impact in getting quicker acute treatment and overall a much better recovery, which I am extremely grateful and lucky to have received. In terms of unmet needs, I believe there has to be a much bigger focus on the long-term impacts of living with the condition. And by that I mean both the initial, say, 12-month recovery phase from an episode, as well as many years after that, regardless of whether a relapse happens or not. I think there's much more to be done in terms of the consistency of the care, which seems to vary a lot depending on the location of the patient, and a much bigger focus on things that are actually directly under the patient's control.
My name is Lila Wakefield. I'm 6 years old and I have MOGAD.
Layla was diagnosed with MOGAD at the age of 15 months. We are blessed in that we just celebrated her 5th year of being relapse-free. While the medical community has made many strides in the short amount of time since her diagnosis, there are still unmet needs for many patients and their families, including ours. More research is needed into pediatric, cognitive, and visual outcomes so that families are better informed at diagnosis of the course that their child might take. Next, more options for efficacious drugs that are both affordable and easy to administer to pediatrics are needed. While IVIG has been effective for Layla, the cost has been a financial burden, and Layla's needle phobia has been challenging to navigate. Finally, more mental health support is needed for the toll this diagnosis takes on both patients and their families.
Hi, I'm Eleanor. I've been living with MOGAD for 8 years. I've had multiple relapses along the way despite trying different preventative treatments. I'm super lucky to have an excellent team that respond extremely quickly when I'm experiencing an attack. So in terms of medical care, I feel like all my needs are being met in those acute moments. But for me, what's unmet is a clear, consistent, long-term treatment plan. I've tried multiple medications that haven't worked in preventing MOGAD attacks, and there's still no defined pathway for when those first-line options don't work. Going forward, I feel we need to prioritise relapse prevention through more personalised, evidence-based protocols and reduce this variety in the care people are receiving globally.
Hello, my name is Jennifer and I've been living with MOGAD for the past 2.5 years. Something that's not only directly impacted my family and I since being diagnosed with MOGAD, but also many others of us, is there not being an FDA-approved drug to treat our disease. That directly impacts the amount of work that doctors have to do, and also it not being easily approved by the insurance companies. And secondly, the financial strains and residual effects of the disease, how it directly impacts families, is immense, because not only is it a financial strain, but sometimes a loss of job, inability to do daily tasks that we once were able to do. So it not only affects the patient, but also the entire family.
Hi, my name is Julia Leffler. I'm the co-founder and executive director of the MOG Project. I'm also a MOGAD patient myself. The MOGAD community is really thrilled at the advancements that have made in MOGAD treatment and care, as well as diagnostic criteria. But there still needs to be more work done in collecting data for the community and also to better understand relapse management. It's one of the most difficult things that patients have to go through. Each individual has a different journey. This disease is not multiple sclerosis. It's also not NMOSD. There are many things that doctors still need to understand about relapse management. Until there is enough data to get a standard protocol, We would like doctors to continue to listen to patients and understand that the relapse doesn't always show up on MRI. We appreciate all that our clinicians and researchers are doing for us. Thank you.